Good morning from Houston. My name is Jonathan Urenga, and this is Case Connection Unit 4. And we are going to start off with the first case, which presents with a newborn female coming to the local ER. She was normal, and after 24 hours, she developed some lethargy, some hypothermia, and apnea. The doctor ordered some labs, and it's our job to figure out which labs are best to distinguish between a urea cycle disorder or the deoxygenation. So the glucose we're looking at would be more diagnostic for the deoxygenation disorder because patients with the urea cycle defect would present with a normal glucose. Urinary acids, of course, it would just that would be part of the diagnostic urea cycle disorder because the purine breakdown forming uric acid is excreted in the urine. Then we'd look at the serum fatty acids, which would be more diagnostic for deoxygenation due to the fatty acids found in the circulation come from lipolysis and stored as triglycerides. Plasma glutamine can be used in both. Glutamine plays a role in the acid-base balance in the kidneys, producing ammonia, and a source of carbon donation in the citric acid cycle. The blood work comes back, and we have elevated levels of ammonia, or elevated urinic acid levels, and decreased citrulline level, normal, or below normal levels. Okay. Well, this patient obviously is a female, so she carries the X-linked disorder, OTC deficiency, aortic atrophy, and uridine monophosphate synthase deficiency. Less likely is the carbamylophosphate that converts to oleic acid, leading to ammonia. Sorry about that. The hyperammonemia depletes alpha ketoglutarate, causing inhibition of TCA cycle, this decreasing the ATP production, in which case would cause the lethargy and the apnea as well. With this patient, the way she would present would be common for an ammonia level or a hyperammonia. So I would as well order an ammonia level with the suspicion of the hyperammonemia. Okay, that's the first one. We'll go with case number 3. This 47-year-old man presents with severe pain to his right toe. He is unable to bear weight on his right foot, and there's no apparent trauma. He reports the pain started last night and continued to increase in severity. Based on the physical exam and laboratory finding, he is diagnosed with gout. Gout can be caused by several different mechanisms, and blood samples are drawn and urinalysis is performed. The results come back with the plasma urate elevated and the urinary uric acid in the normal. Okay, it says what best explains the presentation of gout in this individual, and please explain why other choices are not consistent with the data and what additional information you might need to decide the cause. So we have 3 choices: overproduction of purines, which is the von Gehr's disease. There's overproduction of purine, that leads to hyperuricemia due to the enhanced production of PRPP from the ribose 5-phosphate. Decreased salvage protein is the Lesch-Nyhan syndrome. It's a defect in the hypoxanthine guanine phosphoribosyltransferase. This syndrome decreases or abolishes the HGPRT activity to include deletions, framework mutations-based substitutions, and messenger RNA splicing. And the third is the decrease to urinary excretion of uric acid, which is hyperuricemia is a risk factor of the development of gout due to the increase of uric acid production and impaired renal excretion, or it could be both. This causes uric crystals to form in the joints or kidneys. And the usual lab uric acid concentration greater than 7.0 mgs per DL is a significant finding for the gout. After further discussion with the patient, he tells you that he recently switched from diet soda to regular soda. He needs to take that fake sugar diet soda was bad for him, so he tells he drinks between 4 to 5 liters of soda a day. The primary sugar in most sodas is fructose or high fructose corn syrup. It says, what potential impact of this dietary modification on the presentation of gout? All right. High fructose corn syrup causes painful gout within minutes of drinking. This is a result of high fructose corn syrup increases uric acid levels. When the body breaks down, fructose purines are released and it breaks down to uric acid. Uric acid forms in crystals and joints and causes the pain. Okay. And here is a little chart. It kind of shows you how the uric acid is formed from fructose. And thank you again for your time. Sorry for my stuttering. I really don't know how to pronounce the enzymes as well as I would like. I've enjoyed the class, and I've really enjoyed the scenarios. Very, very detailed. Okay, thank you very much.